everyone, once again welcome to my YouTube channel. Today we will see another one role play card. This scenario is happening in hospital outpatient clinic and one patient came to you following carpal tunnel surgery and actually he wants to get some information regarding wound care and he is instructed, he is directed from his surgeon. So for getting some information he is approaching you in the clinic. So I will just read you the task, then we can go to the role play. So your patient is 48 years old and is being discharged after having a day surgery for carpal tunnel release. That means an incision in the palm of the hand to cut through the ligament, relieving pressure on the median nerve. And you are seeing this patient to give information on wound care. So you assume that you are in clinic, you are sitting as a outpatient clinic. In your system you have already patient's details from the doctor because he already finished the surgery, and all details regarding the surgery and the discharge plan, the instruction, everything will be displayed in the hospital system, and it is with you. Then why I told you to assume this scenario means the first question you can see, the first task is confirm reason for seeing patient, that means carpal tunnel surgery, information about wound care, and find out how patient is feeling. So the term confirm, if it is there, how you can ask the question? Here actually we have to start with self introduction. I can tell you like this. Good morning, I am Rashmi Rajan, one of the registered nurses working in this hospital outpatient clinic. For our further communication, may I know your full name? And then patient's name is John Thomas, so we can call patient as John. Then the next thing is, okay, Mr. John, from my system, I can see that you have undergone carpal tunnel surgery, and here you came here for getting further information about the wound care, isn't it? Or am I correct? So this is the confirm. We are just asking back to the patient. This is the way of asking the first task. Then we can ask. Then patient is telling that, yes, sister, actually I came here for getting the information. And then we can tell that, how are you feeling, Mr. John, after the surgery? Then patient is telling that it's okay, I am fine, but still I have pain over the area. Then we can tell that, okay, I can understand your pain over the area. Really, I'm sorry to know about that. And I would like to give you some information about the wound care first. So we will proceed with that. Then patient is telling, okay, sister, you can carry on. I can just give the instruction. Here you have to take care because you are going to give some more advices regarding the wound care, then hand care, some restrictions, everything. Here you should not use you have to, you need to, you should, these things and all you have to avoid. How we can present the things? The first thing, removal of outer dressing in 24 hours, leaving wrist dressing in place, keeping dressing clean and dry. Then advice on likely timescale for healing, that is 2 weeks, removal of sutures in 10 to 14 days. Then how we can present? Mr. John, I would like to tell you that please remove the outer dressing, your outer dressing in 24 hours and leave your wrist dressing in place. Moreover, please try to keep the dressing clean and dry. And I would like to tell you regarding the healing process. Almost it will take 2 weeks, and thereafter you can come here for the suture removal within 10 to 14 days. How does that sound? Are you okay with that? Is it clear for you? So these are all phrases. Is any of these phrases you can use there. Then next one is a warn against swimming until wound fully healed, that is plastic ineffective or complete dryness, risk of infection, longer healing time, etc., and explore patient's understanding about care of hand. Then which the warn means you should not use like you should not, and don't, these phrases and all we could not use it here. How we can tell? For your further information, I would like to advise you to avoid swimming until your complete wound healing, because the plastic is ineffective for complete dryness, and if you swim the moistures will be there inside and it will increase the risk of infection and it will lengthen the healing time also. So I'm strongly suggesting you to avoid swimming. I hope it's clear for you. And do you know anything regarding your hand care of your hand? And patient is telling that it is clear, sister, but I don't know how to take care of my hand. No need to worry, Mr. John. I want to remind you about the hand care to elevate to minimize the swelling, but you can use your hand for light activities for 48 hours postoperatively, and it is essential for you to do finger mobility exercises. In addition, I would like to tell you that pain relief medications are essential for you whenever it's required. Okay, then along with that, there are some precautions you have to the some other precautions are there to follow during your post discharge time. You are restricted for heavy lifting and driving until wound healed. Either you can tell like that, or else you can tell that it is vital for you to avoid heavy lifting and driving until complete wound healing. Like that also you can present. Then find out any other questions you can ask. Is it okay for you, or is it clear, John? Do you have any other concern? Patient is asking that, okay sister, you told me many things like wound care and hand care, everything. From where I will get the things, the wound care materials, and what about my follow-up, this follow-up appointment for when I have to come back for the follow-up, these many things. Then we can tell that I can truly understand your concern, Mr. John, but no need to worry. Upon discharge, we will provide you a discharge pack in which follow-up appointment informations are included, along with the wound care materials and informations, medication advices, including hand exercises. So you will get complete information regarding your post-discharge care and management. How does that sound? The patient is telling that, oh, it's fine. It will. I hope it will be helpful for me. Yes, every informations you can get from that package. Then, okay, Mr. John. At last, I would like to inform you another one more thing. That in case if you have fever or swelling, or if you are feeling an increased pain at any time during your home stay, please get medical attention as much as early as possible. Do you have any other concern? The patient is telling that, no, I don't have any other concern. Thank you for information, and we can wind up. Okay, Mr. John, I hope I have clarified all your doubts. Meanwhile, if you need any clarifications, you can contact with us anytime, and the phone number is given in that discharge pack, so that you can make a contact, make a phone call with us. We are there to help you. Okay, thank you for your time which you spend with me. So that's enough. With that, we can wind up the scenario. So in this case, role play card, what is the peculiar thing means there are more advices. So patients' involvements are very less, and your explanations are more. And explanations means you are not getting more information, you are giving more information. So you have to keep it in your mind. You have to be polite, and you should not use more demanding words like should, and don't, these things and all. So instead, you can use please. It is essential for you to, it is beneficial for you to, it is vital for you to, please try to do, please try to avoid these phrases and all you can use instead in these scenarios. So I hope it is clear for you. Actually, this is exam care role play card, which appeared on 10 September 2022. So like this one card will be there for your exam also, like post operative instructions or post discharge instructions will be there. It can be in outpatient clinic, or it can be in the hospital ward also, and even in emergency department also you can get such cards. So try to follow these instructions and all. I hope it will be easy for you if you practice in this way, but time period is very much important. You can keep your timer and practice always, and try to get a speaking partner always, and don't practice by yourself. So in that way you can improve your speaking. Okay, we will see you with another one informative video. Until then, bye, take care.